Multiple choice question number 1.
A 5-day-old neonate presents with lethargy, poor feeding, and temperature instability. Blood cultures are pending. The baby was born at term with no complications. Which is the most appropriate initial empiric antibiotic regimen? The options include ceftriaxone plus vancomycin, ampicillin plus gentamicin, piperacillin tazobactam alone, meropenem plus vancomycin, and amoxicillin clavulenate.
The answer is B, ampicillin plus gentamicin. This is the first-line therapy for early or late neonatal sepsis because it covers Group B Streptococcus, E. coli, and Listeria monocytogenes with a synergistic bactericidal effect and appropriate spectrum. Option A, ceftriaxone plus vancomycin, is avoided in neonates due to risk of kernicterus and calcium precipitation. Option C, piperacillin tazobactam, may be used in resistant cases, but is not first-line. Option D, meropenem plus vancomycin, is reserved for severe resistant infections or NICU settings. Option E, amoxicillin clavulanate, is inadequate for neonatal sepsis due to poor coverage of resistant gram-negative organisms.
Multiple choice question number 2.
A 3-month-old infant presents with failure to thrive, sweating during feeds, and tachypnea. Examination reveals a pansystolic murmur at the lower left sternal border. Which is the most appropriate next step in management? A, immediate surgical closure. B, start indomethacin. C, start diuretics and ACE inhibitors. D, observe and reassure parents. E, start propranolol. The answer is C, start diuretics and ACE inhibitors. This clinical picture suggests a significant ventricular septal defect, VSD, causing congestive heart failure. Initial management involves medical therapy with diuretics, for example furosemide, and ACE inhibitors to reduce preload and afterload before considering surgery. Option A, immediate surgery, is reserved for refractory heart failure or large defects not controlled medically. Option B, indomethacin, is used for PDA closure, not VSD. Option D, observation, is inappropriate due to symptomatic heart failure. Option E, propranolol, is used in conditions like tetralogy of Fallot for hypercyanotic spells, not VSD.
Multiple choice question number 3.
A 4-year-old child presents with a generalized tonic-clonic seizure lasting 8 minutes, actively seizing in the ER. What is the best immediate management? IV phenytoin, IV lorazepam, oral valproate, CT scan brain immediately, or IV mannitol? Answer is B, IV lorazepam. In active seizure, status epilepticus, the first-line treatment is a benzodiazepine, such as IV lorazepam, which rapidly terminates seizure activity. If seizures persist, second-line agents like phenytoin may be used. Option A, phenytoin, is second-line. Option C, oral valproate, is not appropriate for acute seizure termination. Option D, CT scan, is important but only after stabilization. Option E, mannitol, is used for raised intracranial pressure, not primary seizure control.
Multiple choice question number 4.
A 10-year-old child presents with polyuria, polydipsia, and altered sensorium. Labs show glucose 450 milligrams per deciliter, pH 7.1, ketones positive. What is the most critical initial step? A, start IV insulin bolus. B, immediate bicarbonate therapy. C, fluid resuscitation with isotonic saline. D, start oral hypoglycemics. E, give potassium immediately without labs.
Answer is C, fluid resuscitation with isotonic saline to restore perfusion and reduce hyperglycemia. Insulin therapy is started after initial fluids. Option A, insulin bolus, is avoided due to risk of cerebral edema. Option B, bicarbonate, is reserved for severe acidosis, pH less than 6.9. Option D, oral agents are inappropriate. Option E, potassium, is important but should be guided by serum levels.
Multiple choice question number 5.
A 6-year-old child presents with pallor and fatigue. Labs show HB 7 grams per deciliter, MCV low, ferritin low. What is the best next step? A, start iron therapy. B, bone marrow biopsy. C, Start vitamin B12. D. Blood transfusion immediately. E. Start folic acid. The correct answer is A. To start iron therapy. These findings are consistent with iron deficiency anemia, and oral iron therapy is the best next step. Bone marrow biopsy is unnecessary. Vitamin B12 and folate treat macrocytic anemia. Transfusion is reserved for severe symptomatic anemia or hemodynamic instability.